Good morning, everyone. Today, I will discuss with you the meaning and scope of salt restriction, which is required to be done by many patients who suffer from heart disease or high blood pressure. Doctors usually advise to reduce salt intake and call it as salt restriction. What does it mean and how much salt is to be reduced? I will be discussing this point in simple language. Now let us basically understand what do we mean by common salt or table salt. It is sodium chloride which contains sodium and chloride ions. The atomic mass of sodium is 23 and atomic mass of chloride is 35.5. So the total becomes 58.5. We say one molecule or one mole salt will contain 58.5 grams of the sodium chloride as such. Therefore, percentage of sodium would be about 39%. Thus, 10 grams of sodium chloride will have 3.93 grams or approximately 4 grams of sodium, or 5 grams of common salt or sodium chloride would have only 2 grams of sodium. Please remember, it is sodium which is most important consideration when we talk about salt restriction. Now, body needs sodium in certain amounts which varies from country to country depending on the temperature and hot environment, but usually it is approximately 2 gram salt is needed for proper functioning of the muscles, various cells, nervous system, and also maintaining blood volume. Now, usual intake is much more than actually physiologically required, and there is a tendency for more water to be retained when more salt is taken, and blood our blood vessels react in different way and their resistance increase, so there is rise in the blood pressure also. So lot of changes occur when high sodium or more salt is taken. Now, large scale studies have shown that there is a positive relationship between the amount of salt taken and rise in the blood pressure or increase in the risk of cardiovascular heart diseases. And these studies also show that limiting salt intake reduces high blood pressure and also reduces remarkably risk of heart disease and strokes. So we can prevent paralysis and heart attacks just by reducing salt. And this is doable, and therefore salt restriction can avoid unnecessary adverse health outcomes and cardiovascular deaths. What do we mean by salt restriction? In many Asian countries, salt intake per person is about 10 grams or more. Somewhere it is 12 grams, sometimes it is 9 grams, and the average daily intake of salt in USA is 6 to 8 grams per person. Salt intake of less than 5 grams 5 gram comes as approximately 1 teaspoonful for adult, helps to reduce blood pressure and risk of cardiovascular disease, as we have already discussed. Salt restriction means limiting sodium intake to 2 grams per day or less. That amounts to limiting common salt intake of 5 grams or less. And this must very clearly be understood. Now, there are large number of Indian food items which have very high salt content. Breads, rolls, pizzas, papads, vada paos, sambar, sandwiches, chaat pakoris, snacks, soups, sauces. There are just few examples. There are a large number of them actually, depending on the socio-cultural habits. The amount of the salt is added into these items, and various other preparations are made which have very high salt content. Now, salt is also commonly used in making masala dosa, buttermilk, cooking vegetables, chapatis, puris, parathas. And extra table salt is always kept and it is added to the prepared vegetables according to the individual choice rather than need but due to individual choice and habits. Now, what are the types of the salts which are being used? The most common one is called as common salt or table salt. The others are black salt or kala namak, Celtic or grey salt, flower salt, Himalayan pink salt, marine or sea salt, Persian salt, red salt, rock salt, and sambar lake salt. Now I'll be discussing something about each one. Common salts. Sea salt is unrefined and has traces of minerals like magnesium, calcium, potassium, iodine, and microplastics that must be understood. Now, this is the most common source of the table salt in our country. Some sea salts have coarser crystals, so smaller volume is occupied when a teaspoonful is taken. That may yield little lower sodium, but sodium is always there in sea salt. Common salt is a refined from sea salt and iodized. By iodization, we mean more than 15 parts per million of iodine. Sambar salt is a special salt which is obtained from the Sambar lake in Rajasthan, which is extremely salty. The ionic composition of this salt should also be taken into consideration. This lake salt has 37.5 grams per liter of the sodium. It also has potassium, chloride, sulfate, carbonate, and is alkaline in pH. So, lot of dissolved solids are there in Sambar lake salt. Himalayan salt is pink and pink color is because of high iron content. Its sodium content is more or less same, that is 35 grams per 100 grams, and other trace minerals are found into it. Over 40 trace minerals are found in it. It is said that it reduces muscle cramps, probably due to magnesium content. It is considered as a healthier salt, although the evidence is lacking. Grey salt is also known as Celtic salt. It is grey because of clay content and is found in European countries. It is considered to be helpful in reducing muscle cramps. Kala namak is found in various parts of India and Pakistan, actually in Asia. It is obtained from the Khewra mines in Punjab province of the Pakistan, and actually it is the rock salt, but it is obtained by heating rock salt for 24 hours in special pitchers made for this purpose. They are called as matkas. It has high charcoal content. It has different colors or hues, black hues, because of varying sulfite content. Sulfites are considered to be good for digestion. So these are the benefits of Kala Namak. It should be remembered that sodium content is same. Other types are Hawaiian or red salt, flower salt, and Persian blue salt, which are less often used and may be found in respective countries. Now, it is important to understand the sodium content of the salts from different sources. Whether it is sambar salt, it is flower salt, is a rock salt, or common salt, the average sodium content is similar, if not same. And that must be appreciated as very important because health outcomes are dependent on amount of the sodium which we take rather than type of the salt we take. Now, there are many misconceptions. Rock salt, senda namak, kala namak, or sea salt is considered to be better, healthier. What is to be understood is it's the sodium content rather than other contents which are more important for the health outcomes which are studied. Uncooked food does not have any sodium, so it should be added. Small quantity of sodium is found in all eatables naturally. The salt is added to increase palatability and taste according to the individual habits and cultural characteristics, socio-cultural habits. Only elderly should limit salt intake. Not only elderly should limit salt intake, but at all ages the benefits are found of the salt restriction. Therefore, the rule applies to each and every one. Now, question is how to reduce the use of sodium or salt. Resist temptation of sprinkling extra salt on prepared food. Use other spices, lemon, lime, herbs, and condiments to the cooked food so that it becomes more palatable and tasty. Avoid use of chaat masala, jaljeera masala, detox drinks, masala dosa, and such prepared packed items which have very high salt content. Occasional use may be allowed, but it should not be on regular use. Use fresh fish or lean meat if you are non-vegetarian instead of canned, smoked, or processed meats. Do not sprinkle salt on salad, cut fruits, cooked vegetables, or curd. Enjoy this as such, or squeeze lemon on it. It becomes habit. It is similar. When a diabetic says that I cannot take tea without sugar, it is better to take tea without sugar, and ultimately one develops taste for it. Limit use of baking soda, baking powder, and monosodium glutamate, which are found in many beverages and foods. They also have high sodium content. We say it is a hidden form of the sodium actually, which is not known. If you are going out to dine on weekend, instruct the owner to prepare low salt food for you. If not possible, then avoid ordering foods which have high salt intake, such as potato fingers, salted nuts, masala dosa, papads in excess. A word about salt substitutes. Now, there are two types of the salt substitutes which are currently available. One is low sodium substitutes which have added potassium, and some brands have 15% lower, or others have 30% lower sodium content, because this percentage is uh, added with potassium iodide. It is compensated with potassium chloride. Now, there are other salts which only have potassium, about 8% of potassium chloride. Potassium lactate have been used as food preservative, and potassium citrate could also be used, although they have other actions which are undesirable. Apart from these two important substitutes, seaweed granules and salicornia powder, which is green salt, are also used as substitutes. What is more important, that most of us will try to use salt with low sodium replacements to 15 to 30%. Now look at the available brands. Regular salt has 38 gram per 100 gram of sodium and no potassium. Low sodium salts 15% have 32.8 to 33.4 grams of sodium. Still they are enough, but it's 15% less, and the 15% is compensated say with 7.8 grams of the potassium. Potassium also considered beneficial when taken in small amounts, but larger doses of potassium will also not be harmful to our body. I will be discussing this point. Low sodium 30% brands are also available, which have 26.86 grams per 100 grams of the uh, salt as sodium, and also has 15.75 grams of the potassium as potassium chloride. Senda namak, I'll stress again, has same sodium content 37.16 and very trace amounts of the potassium. Himalayan pink salt also has same sodium content 37.5 and very low amount of the other minerals. Pure potassium chloride has 8 grams percent of the potassium. I have already discussed. So appreciate that sodium content of all the types of the salts available and all the brands are nearly same except low sodium 30% or 15% blends. Now a word about potassium salts. There is some evidence that replacement of sodium chloride with potassium enriched salt substitutes lowers systolic and diastolic blood pressure by 5 to 2 millimeter mercury respectively. However, there are disadvantages. Potassium chloride is bitter and irritant. Potassium excess is known as hyperkalemia and it is considered to be very bad for heart, and especially when one has kidney disease, because kidney will not be able to excrete, remove excess of potassium which we are taking, and therefore potassium tends to accumulate in tissues in body and in heart, and therefore it will cause rhythm disturbance, irregularity of pulse, and poor functioning. It may lead to sudden death if it is too much high, beyond 7 millimoles per liter. And this is particularly true with those who are diabetic with impaired renal function. Therefore, unlimited use of potassium containing salt substitutes may pose a health hazard. Now, it must be appreciated that we are not only taking the potassium salt substitutes, but we are also taking normal diet which also has potassium, and also potassium rich foods are also there which somebody must be taking. Now think of a person who has a kidney disease. All these add to the tremendous amount of potassium in our body, and that may be very bad. Therefore, the key points are that all salts from different sources and brands have approximately similar quantities of sodium, and it is sodium that is important for the health. Excess sodium is problematic because it may cause high blood pressure and heart disease and stroke. Sodium rather than the source of salt is important in considering planning for restriction of the salt. Salt restriction, that is restriction of the sodium 2 grams or less, is an important measure to reduce blood pressure and risk of cardiovascular disease. It is cost effective also. You don't need to have extra burden on the pocket. It is best to avoid opting for K salts or salts from alternative sources unless we observe a discipline and use them sparingly. Salt self-determination is important in limiting use of salt and adhering to low salt diet for health benefits in long term. And thank you very much for watching this video.